Hey guys, Dr. Norm. Wanted to get back to basics today. One of the basic definitions of chiropractic is that it's the detection and correction of subluxation. Oftentimes in school we can get so bogged down with the scientific answer, our science, philosophy, and art, we can really get heavy into the science, which is a good thing, but when it comes to going back to the basics, it's very important to know your philosophy. And one of the things is, what is your definition of subluxation? So that's something you really need to wrestle with. You really need to figure it out for yourself. My definition that I've come to over the years is that a subluxation is when there's a bone that's out of place, it's stuck there, and it's causing pressure on the nerves. So I know it's much more complicated than that, but when I try to communicate that to patients, or at a networking event or something like that, I need a quick, concise way of explaining it. So it's out of place, it's stuck, and it's causing pressure on the nerves. Now, how that applies in your practice, your analysis of that patient had better be looking for those things. So if you say that your definition of a subluxation is a misalignment between two vertebrae, and then you go and you start doing either a muscle test or a leg check, and you're not actually checking for a misalignment, you're not checking for a malposition with either static palpation, motion palpation, x-ray, something like that, you can't really claim that anymore. So if you're saying, let's say for example, your definition of subluxation is that it's a fixation, so that the joint is stuck, or it's not moving as well as it should. Well, if you're not using motion palpation during your analysis, you can't really claim that. So I'm not here to tell you one way or the other. I want you to understand that you need to be very clear of what you define as subluxation to be, and then you need to be looking for that. You need to be able to find it, and you also need to you need to have a way of checking to see if the patient is clear. So there needs to be an objective way of finding it, an objective way of finding those characteristics of the subluxation that you've defined, then a procedure to remove that, and also a procedure to check and see if it's gone. So wrestle with that for a while. What is your definition of subluxation? Not the textbook definition that you might get in school, but something that you can summarize and use when you're talking to patients. A real quick answer.